It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, my friends, if you remember when I was here at the Lehigh Valley Hospital, Hazleton, we were showing you about the new ER phase, and that was phase 1. Well, the exciting thing now is phase 2 is finished, and there's so much to be said about it. I'm bringing my co-host in, who's the medical director, Dr. Andrew Miller. So first of all, congratulations.
Thank you very much.
This has been a challenge. It's wonderful to see, I've been, for many, many years, Doctor, I've been talking about the healthcare that we have in our area, okay, in Greater Hazleton. And at one time, many times, people would say, well, we have to go to town. Well, that's changed. But when we look at this facility, over close to $25 million investment in the area, it's exciting, okay? First of all, I hope I never have to use the
That's right. Yeah, you don't want to see me.
Yeah. Well, but however, God forbid things happen, we're going to tell the audience today, the viewers, all of the great things that we have here, okay? So let's talk about you. Who are you?
So yeah, well, thanks for asking. I'm Dr. Andrew Miller. I'm the medical director here at the Hazleton Emergency Department. Started this job about 1.5 years ago. Has now been part of the family, and really excited to be part of this expansion. It's really been great for the community, and great for just everything.
Now, folks, I know you're looking at him saying he's probably about 18 or 19 years old, but he's been around, okay? So how many years you've been practicing?
Yeah, so I started my training in 2002. So with the network, I've been with the network since then. So 2002 to 2006, did emergency medicine residency, and started in the group down at Cedar Crest and the trauma center, and just been kind of working and doing my thing, and kind of enjoying every minute of it.
The fascinating thing about ERIs, we were talking about your wife's an RN, my wife's an RN, but we're talking about the fact that when an emergency and a patient comes in, how everyone gets together and works in sync, and without having the patient panic the way it is, because I know I would be a nervous wreck, okay? But the training here has been just fabulous.
Oh yeah, absolutely. I mean, I tell you what, when we go into action, it's really a beautiful thing to see, because the whole team gets together, the nurses, the techs, the doctors, the nurse practitioners and PAs, and we are all, do what we have to really care for the patient. And it works so smoothly. We're all in sync, and it probably seems chaotic to the individual person, but for us, this is like our controlled chaos, and it really works well.
Well, now that we have this expansion, and as we're saying, there's so many things we want to talk about, okay? It's we said a close to $25 million investment here. Let's talk about the, when you're talking about a private room with glass doors to ensure privacy and health information, how does that benefit the patient?
Well, for sure, this is so important to patient care, right? Because you want to try to get them out of involved with every other patient. And so to get private rooms like you see here, it's just really nice, just so they can get their own, be more comfortable, be able so that I can converse with them and do a thorough history and physical exam and not have to worry about it. Having glass doors is important, because then, from a staff perspective, we can actually still be able to see the patient because they're sick and we want to have our eyes on them. But we have curtains for their privacy, and so we maintain total privacy, but with the comfort that really every patient deserves.
So how does, let's take us to a person's coming in here, and you have to, either they're having pains in their chest or whatever the case may be. What it would be, I know the different processes for different individuals, but how would be the general thing? What happens when they get here? Take me from step 1 to the treatment here.
Sure. So when you come into the front door, we've actually changed our process in that point. So we now have a nurse that will greet you right when they come in the front door. And so they'll be right outside, they'll get registered quickly, and depending on their acuity, if they have chest pain, for instance, it could be a heart attack, so we want you back here as fast as possible. If it's an ankle sprain, we might move you to a section of the emergency department that we deal with the lower acuity. It's called super track, where we get patients really rapidly through for kind of those lower acuity but still urgent conditions. But you come in, if you have a chest pain, for instance, you'll get rapid blood work, quick physical exam, EKGs, and you'll be started on that whole cascade that we need to really diagnose what could be going on. You'll get moved back to a private room. We'll start any diagnostics, whether it's a chest x-ray or whatever else that might need to happen, and start that. as we go forward.
Okay, so the waiting time has always been a concern, okay? We've had problems, or not major, but concerns. And I guess some people in the medical industry, you know what triage is. Right. And you know that, you may be there, but however, someone just came with a heart attack, so you're bumped because that's more important. So how does that system work here? Will it be a lot faster for patients getting into the emergency room?
Oh, absolutely. I mean, with this second phase, and even the first phase, we've already developed that process where it's actually, probably we've dropped time by 50% or more. And so what happens is, because we have the nurse to greet you at that front door, we can really rapidly identify those, that really need acute conditions. So, if you're a chest pain, you should be bumped ahead of the line. Mm-hmm. But that being said, because of all of our other things, we're able now to kind of put people where they need to be. So we've created an ER, not just a standard ER, if you will, but an ER that really can take every different condition and put them in a place where they can, to make it as efficient as possible. So that's really going to be, it's a dramatic improvement of where we've been in the past. And so it's really the future of healthcare. And frankly, I've worked at a lot of emergency departments. This is truly unique in a sense of what we're doing, really ahead of every other ER I've ever worked at.
When you're looking at someone comes in with a heart attack or a stroke, when do you decide that they should be either life flighted to Allentown, or will that cut the time now that we, in other words, let's say 10 patients come in,
right,
and of the 10 we're going to Allentown. Now that we have new facilities, will that cut down to maybe 8 or 7? You know what I'm trying to get at here?
Yeah, I see what you're saying. I mean, our number one goal, of course, is we want to keep people in the community. We don't want to just ship everybody out. What's happening now is what I've seen over this last year and even last couple years is really this transition where we're able to provide a lot more services here at the Hazleton campus. And so if we have to, if they're a trauma that needs some specific care, or if they need a cardiac catheterization, like if they're having a heart attack, they will still go down and to Cedar Crest and get treated where they can very rapidly, get them down, as because we have all those processes in place. But we also have telemedicine and different things, so we're able to provide services, and we will be seeing less and less transfers as we can continue to keep people in the community where everybody wants to stay.
You mentioned something I think is fascinating, the telemedicine, because I remember of 2 years ago, whatever, when we did a mountaintop at one of the campuses, so I was fascinated. Explain how that works.
Yeah. So we basically have, just like it sounds, just like a television screen with video capabilities where you can communicate directly with a physician, a specialist, even a nurse. And so we now will, if in our triage process, if there's any wait, we're going to try to use the telemedicine capabilities to get the patient rapidly triaged. If you come back and I need to see if you're having a stroke and I want a neurologist to see you right away, we could put the screen right up and they can communicate right with the neurologist. And I'll be at the bedside with the neurologist and the patient, and it works really, really unbelievable.
So we're talking about communication, and communication and knowledge is so important, all right? So now we mentioned here, and I'm sure some people would know what the EPIC EMR system is. Okay, why is that? What is EPIC, and how does that benefit the patient?
Sure. So EPIC is our electronic medical record, and what's nice is it's all documentation, real time in the computer system. And so, as you can see behind you, we have a computer right in the room, so I can pull up and start documenting right away, put the orders in. But what's nice about EPIC, and what's transformed how we care, is that it has, it has our records, ER records. It has the hospital records, right? We could see those. It has records if they were ever at any of our campuses. It has the records if they see any of our Lehigh Valley Physician Group practices. So if they went to our express care, if they went to one of our family doctors, if they see our oncologist, whatever specialty, it's all in the computer. So I don't have to make phone calls or get all these paper records. I can get real-time access, right at my fingertips. But it actually, and I didn't even think about this, but what we've actually seen this transgression is that, now what we could see, this transformation is that I might be documenting on a patient. I have a patient that needs to go to Allentown because they're really sick and they need trauma care that we don't provide here. The trauma surgeon can be seeing exactly what's on the electronic record real time. They can see the CAT scans and X-rays real time, and it's just really changed and transformed how we care for patients.
Speaking of being on top of things, when you're looking at the patient's information, now, if they already have been if their doctor is a part of the network, Well, their information's already on the system.
Right.
Okay, so for example, I'm a part of, I go to Dr. Benio,
Right.
so all my records are there. God forbid something should happen. You could just go and say, oh, he had blood work here, he had this, and
Yeah, we can see your blood work, like if you had EKGs, because we want to compare those maybe, your last visit to Dr. Benio's office. So it's really, it's so helpful, because a lot of times, you don't plan to be sick. You don't plan to come to the ER. Yeah. But when you do, we're here for you, and we have that information ready to go. And even like when we talked about checking in, when you check in, your systems, your information's already in there. So we verify a few things and get you right back. Don't have to start over.
of course, when someone comes to the ER, the family is concerned and everyone's in panic or whatever. You have consultation rooms now, right, for patients. How is that going to benefit the person?
Well, what's so nice is because, we have to have a lot of conversations with families, and sometimes it's certainly appropriate in front with the patient and involve the whole family care. But sometimes oftentimes we'll have to also talk outside the room, and we now have more private setting that we can actually talk to the families and, just be more comfortable, more private, and just to, be able to provide that experience, I think is so important.
When you say easier access for ambulance arrivals, what does that mean?
So as as pulling up, we have a separate ambulance entrance, and so the EMS facilities they'll come right in, be able to bring the patient right, and based on where we kind of sit and position our staff, we're able to kind of interact with them real time and just be able to start the care, kind of again right at the front door.
Before I go to break, I want to ask you this question. Okay, you have a great reputation. You cover both hospitals. How do you think this particular ER, the Lehigh Valley Hospital, Hazleton, ranks with other ERs in the state of Pennsylvania?
Oh, this is among the best. I mean, if I was sick, I would not go anywhere else. I would come to Hazleton ER. This is the place that you want to take your loved ones to. This is the care. The care you get here is as good or better than anywhere else you'll ever get.
Folks, I'm talking to Dr. Andrew Miller. He is the medical director here. We're talking about phase 2. It's fabulous opportunities. I hope you never have to use it, but the point is when you do have to use it, you want to make sure you're in the best of care and the latest in technology. We'll take a break. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. We're on location here at the Lehigh Valley Hospital, Hazleton, and we're here with Dr. Andrew Miller, who is the medical director. Now, before we talk to Dr. Miller, let me tell you, ssptv.com, all of our shows, the 21 shows that we produce, are on the website now. We no longer have the app. You'll find the website be much more convenient, and all the health shows we've done here with Lehigh Valley are on the website. So we're talking about this expansion, folks, over close to $25 million expansion. Put us in the top ER systems in the state of Pennsylvania. A couple areas I want to talk about.
Sure.
Let's talk about the Trauma Bay area and everything that's affiliated with that.
Sure. So Hazleton, our Hazleton campus is a level 4 trauma center.
What does that mean?
So that basically means we have all the protocols and processes in place to take care of any trauma within the surrounding area. So if you're in a trauma, the paramedics know that they should get you to a trauma center before any other emergency department. So the closest trauma center. So because of that designation, we have the state knows and has recognized that we have all those things in place to truly take care of the trauma patient.
Okay, so when you're looking at there's another lab pneumatic tube system. What does that mean?
Yeah, so what we designed and instituted with our new expansion here is a tube system. And so what that does is basically a direct shot from our ER to the lab or to the pharmacy, so that we can send, if I get blood work from a patient, I can send it right down, it'll get right down to the lab, rather than have to walk it across the hospital, or rather than waiting for a courier or something to take it somewhere else. So that will get to the lab in minutes, or seconds really, and really speed up and make things more efficient as we get and wait for blood work. The same thing is from pharmacy. If I need a medication to come from pharmacy, it can be through the tube system. So it's a direct shot, a direct linkage with those two departments, really cutting down on the time and the wait time for the patient for getting their results, getting their medications, and making it easier so my staff doesn't have to leave the ER or the bedside and can deliver that.
So what I'm getting from this, Dr. Miller, is that time is of the essence. Okay, and so the more time you could cut off in getting to the patient's solution, the better off for the patient.
Absolutely. I mean, there's multiple studies that show that both morbidity and mortality go down the more efficient you are. Mm-hmm. Obviously, it's a better patient experience, mm-hmm. and we're able to serve more patients. Because if I can, efficiently move patients through the system, the patients that don't have to wait quite as long to get back.
When I was interviewing the phase one, we talked about, when Dr. Valente was here, talked about when you say level 4, okay, yes. and you get approved by the DOH or whatever case may be. This is not an easy thing. Explain. So folks, they just say, "All right, here's $10,000. We'll give it an award." It doesn't happen that way. There's a whole amount of processes that you have to go through before you get these certifications or whatever. Correct?
That's correct. Yeah. So the designations, there's, as you know, several different levels, and so the Pennsylvania Trauma Foundation will come and they'll do a big inspection and make sure that all those things are in place. So a level 4 implies that, again, we have all of the ER capabilities to take care of those patients, versus, let's say, a level 1 that has the trauma and neurosurgeons right on right in the ER or available 24/7. But it's great because being a level 4 trauma center means we can take care, we could stabilize the patient, and we could do what we need to do to save their life and then get them to the place should they need to be transferred or keep them here.
Some other things with this expansion here, you have the women's specialty room. What does that mean?
So again, lactation, rooms or just rooms for privately if a patient needs a nurse or whatever needs to happen for that. And again, just to provide more comfort and privacy to our patients and staff.
Part of that also is the children's area, right?
Yeah. So in the waiting room, we try to divide out the children from the adults because, kids aren't little adults and they're scared, and we want them to feel comforted and just to kind of enjoy the experience as much as possible. But it's getting to the point where some kids don't want to leave. They love coming to the ER. I don't know.
Is that right?
That's right. Oh, yeah.
Oh, yeah. Well, you have 4 children, right?
I do have 4 kids,
yeah. Okay.
So.
Can't believe it, right? I think he's 18 years old. The expansion here, okay, it was a tremendous investment that Lehigh Valley made. And you've been here for over a year, you said, but
That's
you've
right.
been practicing since 2002. When you look at, as the viewers looking at it, and again, we hope they never have to use it, but unfortunately in life things happen. How would you translate this expansion to the community in saying, okay, here's all the things we have to offer to your community. No need, of course, to run out of town, which is absolutely ludicrous right at this particular point in time. So, in general, if you're talking to 100,000 people, what do you tell them?
Yeah. Well, I think that when I first came up and over the last several years, we've listened to the community. What do we need? How can we provide the best experience and the best care? We've always had good quality people. We've had good doctors and we've had good nurses. But now, how can we make that better? How can we make things improve them? And so, building a better facility is the first step, right? You can increase the facility, make it better, make it nice and clean and new, and just provide more comfort and more of these little kind of details to the patient. I think that's really important. But we've also worked on 2 other things. People, so we've increased our staffing, and I think that's really important because you can't burn people out. You want the staff to really be able to take care of the patients that are there in front of them, and not have like 10 patients to take care of, for instance, like 1 nurse. You can't; those ratios just can't and shouldn't happen. And the final thing we're really working on with this expansion is not just this expansion; it's the processes around it. So developing all of that stuff is going to really create this huge new experience for the patient. And so I really feel strongly that the community is it's going to blow their mind on what's now the emergency department in the Hazleton campus is going to offer.
When you say processes around it, what do you...
Yeah, so the first one is our front door process. So a pivot nurse right at the front door greets you. Before, we'd have the registration clerk just enter your information. Yeah. Now you're going to be greeted by the nurse. Find out exactly, look at the patient, find out exactly what's wrong with them. Get them right back to where they need to. We have a super track. We never had that before. This is a super track is the set of rooms, 3 rooms, where a patient will come in and really be rapidly seen for, some lower acuity emergencies. So ankle sprain brain doesn't have to wait 3 hours to be seen, right? They can go to this little area, be seen and quickly seen, triaged and seen and cared for. And then finally, we have internal waiting rooms, so you're not out with the main waiting room. So when you come in, we have this internal waiting area if you need to wait, while you're waiting for your x-ray results to come back. And again, just more comfortable for the patient.
Folks, I'm talking to Dr. Miller. We're here at the Lehigh Valley Hospital, Hazleton. The new expansion, over close to $25 million, state-of-the-art technology, and most importantly, folks, qualified medical staff. Second to none, qualified medical staff, knowing that when you're in the hands of Dr. Miller and all these people that are here, they're qualified. How they do what they do, I have no idea. I admire them. We'll take a break. We'll be back after this. Welcome back to the Sam Lesante Show, folks. Remember, 24/7 SSPTV.com. You'll be surprised when you go there. All the shows are there, and plus all the productions we do. We're here at the Lehigh Valley Hospital, Hazleton. The new expansion of their ER department is absolutely fantastic. I'm here with the medical director, Dr. Andrew Miller. One thing we have here is there will be 30 treatment rooms plus a 5-bed behavioral health unit.
So this is a specialized unit for patients with mental health complaints. This is a locked unit. 5 treatment bays where you'll be separated from the rest of the emergency department. And the reason this is important is because, unfortunately, with the closing of certain state hospitals and things, we have to be able to service the behavioral health population. And so when patients come in and they have a mental health emergency, we can get them into a unit that's more comfortable for them, and it's separate and it's secure. And because a lot of times these patients will have to wait for several hours to be transferred to an inpatient psychiatric facility if they're going to be admitted. And so because of that, being in a room and in an area that's enclosed is just so valuable, because we have a couch in there, we have TV, we have just some more amenities, because their time will be waiting to be transferred and this kind of thing. And be able to treat them real time is just so important.
I think that's critical, because there's some people that sometimes people over medicate. Yeah. Okay, or they're deficient, and they don't know whether they're cracking up or so you have put them in a unit that you could begin to treat them with. Okay, they may not be as bad as it may seem. Right. I'm not trying to be a doctor.
No.
I think that so there's where the entire atmosphere must be conducive to the patient itself. Am I correct in saying that?
That's absolutely right, because you want to get them out of the main areas for other treatment if you can, because it's more comfortable for them, and it reduces some of their stress and anxiety. I mean, oftentimes these patients have high stress, high anxiety. That's why they're there, and we can help that. But get them into a unit like that, it's just so beneficial. The other thing, in those rooms we have like monitors where we can actually converse with psychiatry and really get some more treatment options started way earlier than we ever have before.
Now, we're in this emergency room now, folks, and you'll notice that there's all these identifications of the doctor, the nurse, the technical partner. Everything's identified, so everybody knows who is what, etc. So that's important, I would think.
Absolutely.
Talking about privacy, okay. This hospital has been just growing and it's beautiful. I've seen some of the private rooms. Where are we at with this?
So yeah, we're very close to really converting many, if not most, of the rooms upstairs into private rooms, because really this is a priority for us. Privacy is a priority, and doing what we can to try to have single treatment rooms as much as possible is a good thing. So we've done those renovations throughout the hospital, not just this whole ED expansion, but throughout the hospital, really trying to create this brand new hospital and experience for the patients.
I think it's fantastic. Dr. Miller here, folks. Anything in closing that you'd like to tell our people about this new expansion and the new ER developments here?
Well, for one, I am just so excited to be a part of this expansion project, and I think it's so great for the community. And I just want to assure everybody and just put a mark that if there's any issues that ever come up, I'm always available 24/7. So I want to hear about it so I can rectify real time any issues that could possibly come up. But this ED expansion is just going to be such a benefit for the the community and for the patients and for the staff to be able to live in this new space and take care of patients the way we want to take care of patients.
Well, so far you've been this hospital has been fantastic. You know, second to none, really. I wish you the best, Doctor.
Thank you very much.
It was nice meeting you
nice
too,
to
folks.
meet you. Thank you.
Remember, 24/7, you have Lehigh Valley Hospital, the network that has really put millions of dollars into healthcare, and it shows. Okay, so once again, I hope you never have to use an ER, but if you do, this is certainly the place to go to. Congratulations again.
Thank you very much.
We'll see you next time.